Hello, I'm Sergiu Draganus, and I'm very glad to have you here present for the Blockchain and Social Disruption panel. We have some amazing panelists participating today. I will start with Otalia from InnovFin, Miguel from Hemera Capitals, and from Singularity University, Pradeep from Solve.Care, and Kingsley from VGC Group. So I would kindly ask you, each of you, to do a short intro of 30 seconds, more or less, of what exactly you are doing before going further and starting with the question I have. So, Otalia, can you please start with a short?
Yes, definitely. Thank you so much for having me. So yes, my name is Otalia Doe-Bruce, and I'm the founder of InnovFin Consulting Inc. So at InnovFin, we focus on blockchain corporate education, project advisory, and strategic design and implementation. And so on the implementation side, we have development and facilitation of financing solutions. So every time I'm focusing on blockchain. So a little bit about myself, I'll try to make it short. My career in blockchain started when I joined the Blockchain Hub, which is a not-for-profit organization that is part of York University in Toronto. And so there, I'm part of the executive management team driving and executing strategies. Sorry, I've been speaking too fast. So subsequent to that, I launched InnovFin, which I mentioned earlier, and I also founded the Innovative Financier, which is a registered not-for-profit group that has quickly grown to about 500 members now. And basically, it's my way of giving back to society by helping individuals in finance embrace disruptive innovation, such as blockchain, which is the subject of our meeting today, but also AI, IoT, and more. And finally, in my lost hours, I read, and of course, I write. And recently, I co-authored a book on crypto finance and mechanisms of exchange in collaboration with industry practitioners and also professors from the University of Ottawa. So that's it for me.
Thank you very much. Thank you. And if you want to continue, please.
Absolutely. My name is Connelly, and I spent 10 years working in the humanitarian aid industry, mostly with Doctors Without Borders. So lived in Central African Republic and the Democratic Republic of Congo, working on medical humanitarian projects, and then got involved in cryptocurrency and blockchain in 2012 and have since been focused on applications of blockchain for social impact, global development, and essentially improving governance structures and systems for people all over the world. So I currently teach out of Singularity University and am the founder and one of the authors of Trust, which is a graphic novel about blockchain that's being written and illustrated by this amazing author named Chief Nyamweya from Kenya. And it's all about looking at blockchain from the perspective of a young Kenyan woman learning how to use it to transform the community around her. So that's me in a nutshell.
Thank you. Miguel, please.
Hello, good evening. Thank you so much for the invitation. It's a pleasure. Well, I work for an asset management and investment banking independent firm. We are focused in Southern Africa. So our geographical focus is Africa in particular, a couple of countries or an area, a region of Africa that is basically the SADC region. We are based in Geneva. We have our first office was open in Luanda, in Angola. And we are also pushing very much the impact finance agenda. So all our strategy and the way we get involved in deals in asset management or advisory, it's really with this focus in a new paradigm that we believe is emerging, which is around the impact finance. I've been working for many years in investment banking and asset management, a traditional career on that area, and working also for many years with the African countries where I come from. And obviously blockchain for these markets, it's an area that we follow very closely, as we really believe that can have a material impact in what we are doing now and in the future.
Thank you. Kingsley, please. We are not able to hear you. Unmute. Microphone. The microphone, okay.
Yes. Good evening, everybody. It's a pleasure to be here. My name is Kingsley Kobayashi. I'm the co-founder of FGC Group. I'm an investor. I'm a serial entrepreneur. I'm into commercial real estate. I'm in the hospitality and entertainment business. I'm based in Japan, born in Nigeria, but I've lived in Japan and Asia for about 30 years, where I have my businesses. Currently, I'm locked down in Lagos, where I'm focusing on using blockchain for commercial real estate.
Excellent. Thank you. Pradeep, please.
Hello, this is Pradeep Goel with Solve.Care, and it's a pleasure to be here, part of this panel. I represent Solve.Care, which is a healthcare platform on blockchain, and we have a rather bold mission to really streamline the administrative, clinical, and financial inefficiencies of healthcare. I have spent my entire career in healthcare on the administrative side, insurance programs, government programs, clinical care coordination, payments, and looking at those challenges and inefficiencies, both in terms of enterprise and individual level access and payments and coordination of care. We decided that we really need to use blockchain in a way that has significant human impact and to really put the human back in the center of healthcare. Because healthcare is less about systems and should be more about the people who need care and people who deliver care. And in doing so, we basically decided to build a blockchain-based decentralized healthcare platform that allows organizations and individuals to collaborate in the context of either managed care or in the context of self-pay or in the context of insured care or in the context of community care. So we have launched the platform. We started the company about 3 years ago. We have launched the platform. It's being used in many different use cases around the world. And we are very excited to launch the latest global telehealth exchange as an open framework for physicians to offer telemedicine to patients near and far. And if we have the opportunity, we'll talk more about it later. So thank you for having me here.
Thank you also for attending. So my first question today is, what are the main sectors blockchain technology might provide disruptive solutions from your perspective? So we've already mentioned some of them. Pradeep told about the telemedicine part, which in my opinion sounds more than amazing, yeah, to do it over the blockchain. So I would kindly ask each of you to jump in and to brainstorm and to discuss about this direction. Which one you think they are the lowest hanging fruits in terms of sectors to be touched by the blockchain technology right now?
Well, I can go first.
I'll start. Okay.
Sure, please go ahead. After you.
So no, I was just going to say that, I mean, of course, the first sector, I'll say, is the financial services sector, because it basically launched the whole blockchain revolution. So because if it weren't for the 2008 crisis and then the desire for people to find a solution to the problem that originated with that crisis, then maybe Bitcoin will have never seen the light of day. And so maybe today we wouldn't be here talking about a blockchain. However, from my perspective, we have to remember that Bitcoin was created as a solution to a problem. And so the problem being the lack of transparency, the lack of trust, the lack of verifiable truth in the financial system. And so basically, if I go back to your question, in my opinion, the question isn't really what main sectors, but rather what type of problems blockchain can actually help resolve regardless of the sector. So I definitely see applicability everywhere, whether it be finance, like I mentioned, but also in healthcare. Somebody mentioned real estate earlier, in media, in art, in transportation, in education, in mining. And for me, the list is endless. And as long as the blockchain can be used as a solution for problems experienced within those sectors, then it has applicability.
Yes, thank you.
Yeah, I think another way to look at it is that people don't buy or get excited about technology except technologists who see a new value proposition. And I think we really need to look at blockchain not as a technology that'll change the world, but the applications that'll compel people to consume and change the way they behave and the way they they live and the way they interact with each other. So my view is that instead of looking at the sector, I think we should look at the human impact of making blockchain accessible and usable. And it is in our sector, in healthcare, the only real value of any technology, be it cloud or AI or IoT or blockchain, is does it impact quality of care, better results, easier access to healthcare? Does the patient have better outcomes, and does the physician have more efficacy in practicing medicine and being more effective as a care provider? So there are other technologies in addition to blockchain that can have a positive impact. But what the blockchain does do, which other technologies have difficulty doing, is allow the decentralization of service delivery and service consumption, which applies to so many sectors, but to healthcare is particularly needed because you have so many silos of service providers, service payers, and service users. And these silos are not connected at all. There is no real mechanism and that e-commerce connects good providers and goods consumers. But in healthcare, that's just not the way the system is set up. You are very regionalized, very compartmentalized, regulatory and other constraints, geographic constraints that governs healthcare. And blockchain has the potential to break down these silos. Now you can use it the way we are using it, which is to really coordinate benefits, coordinate payments, coordinate care across boundaries. You can use it in other ways. There is no one right solution for it. But as long as we recognize that my mother is not going to buy blockchain, she's going to buy an application, or rather an experience that is better than what she has today. And that's the utility we must focus on.
I also would like to add another perspective, and agreeing on what has been said so far, which is not which sectors could be more willing to adopt the blockchain as an underlying technology, but also which countries, which economies, which is also, I think, a very important view, since obviously if we consider the institutional theory, we see that there is something that is called the institutional voids that emerge, especially in frontier markets, in markets where institutions, due to several reasons, historical background, they still have institutions that are weak and are not performing as they should. And so in those countries, for example, using blockchain can be an accelerator for change and for achieving levels of efficiency for the economy, for economical agents, for citizens, that really makes a major impact when comparing with countries where institutions work. They could work better with a blockchain, or they can even become redundant. We don't know, but it really makes a huge impact to see how it can affect certain countries and how it can accelerate the development of certain countries.
Yeah,
Please.
I do agree with everyone, and I'm happy to be one of the speakers at this forum because we have a lot of versatile people here. Blockchain has been around for some time now, and it's making changes all over the world. But the pandemic has catapulted blockchain to a different level. This pandemic has given rise to edutech, has given rise to health tech, has given rise to remote tech, has given rise to work tech. People are beginning to see the importance of blockchain, to see the importance of technology in our daily lives. In the education sector, when you see the young ones who are in Japan, where I'm based, and you look at the young ones who are in Nigeria, where I was born, where I'm locked up right now. I haven't been here for 30 years. I'm here right now, and I'm seeing that there's a big gap. Where children in Japan are used to smartphones, iPhones, iPads, quick internet solutions, and things like that. Those in Africa don't have that infrastructure in place right now. So the application that we are using in Japan or using in advanced countries are not applicable to what we are using in developing countries or underdeveloped countries. However, there are things that we can use in those countries. There are infrastructures that we can build on. So blockchain is going to serve as the basic for different applications to be built. We see in the healthcare sector where coronavirus have affected a lot, that people are not doing telemedicine. People are not doing diagnosis through video calls because we don't want women that just give birth to children to go back to the hospital. You have to be able to use video conferencing or video interaction to be able to prescribe them drugs, attend to the children, attend to different things. Then you also have people working from homes, which has given rise to a lot of digital advancement, both those who were analog before now and those who were privileged to have those abilities. It has given rise to people working together. Actually, I am convinced that in the next few years, you're going to see the first $1 trillion in healthcare industry, because every country right now are putting money. Every big companies are putting money into healthcare. Even African countries or developing countries that their healthcare have been downtrodden are putting money into the healthcare because they discovered they couldn't run to the developed countries to do dialysis. They couldn't run to the developed countries to get healed of some ailments. So people are putting more money into this section. So when it comes to blockchain and the structure in the social service, you're also going to witness legal aspect of blockchain. You're going to experience identity. You're going to experience medical data. So there's a lot of things coming up on blockchain that people can key into in their different geographical areas. So I'm really looking forward to the next few years and blockchain taking us to the next level is what we do. I'll come back to that. Thank you very much.
Thank you. So what I would like to add here is we've discussed a little bit earlier about decentralization. This is clear. And some of the benefits of the decentralization, its security, its trust, is the fact that we can optimize cost, processes, and many other things, which results in a much wider list of benefits. But in real life, so I would really like to go even deeper. So healthcare, it's a very clear example, but I would really like to dig in and go down to the person which really needs, how you mentioned, in Japan, you can make a payment with a smartphone. Some places you cannot do this. So let's go a little bit more in this direction, please.
Yeah, I mean, one of my favorite projects out there is one run by the World Food Program. And they were really early adopters of blockchain and have been one of the few that I've seen in the humanitarian aid sector that's actually been able to implement something at a reasonably large scale. And so historically, when people were experiencing famine, the World Food Program would come in and would bring food for them. But typically, the problem wasn't actually that there wasn't enough food. It was that people couldn't afford the food that was available. And so by flooding the market with this free food, they were actually destroying the infrastructure that was helping people get fed. And so they've moved to a cash transfer system to enable people to buy whatever food they wanted. But the challenge with cash transfer, of course, is, you don't know what people are spending the money on. It's very expensive to deposit small amounts of money to large amounts of people. And that's where, through their Building Blocks program, they were able to transfer Ethereum-based tokens to refugees across camps in Pakistan as well as in Jordan. And the refugees could then use those tokens at food retailers across the region. And then the WFP would transfer the tokens back to local fiat currency with the retailers, as opposed to trying to make, say, 400,000 individual tiny transactions with each refugee, would make 400 with the retailers that were around. And so this, to me, was a great example of how blockchain was implemented in an existing type of system. And they were able to save, I believe it was over $20 million on that project alone. And they do more than $2 billion worth of these cash transfers every year. So it's a huge opportunity for improving services for people in need and also saving money through blockchain technology.
Excellent. Thanks. Thank you for sharing this. Another point that I would like to reach today, it's about the local regulatory frameworks. We know that in some regions there are no regulatory frameworks. In some other regions, people are trying to build something in this direction. So I would like to hear your opinion into this direction. How do you feel the things are going? Which is the current situation? Which is the direction? How the people should improve the fight to bring a real clear regulatory framework which should allow us to bring those amazing projects in that way. Please.
Well, speaking from a healthcare point of view, healthcare is I think, fundamentally first a regulatory problem, then it's everything else. And it is a patchwork. In many countries, healthcare is regulated regionally. In the US, you have statewide regulations. In many countries, the regulations are either archaic or non-existent. So there is a significant barrier. The reason healthcare, like politics, is considered to be a local phenomenon and very locally delivered and locally managed is primarily because of proximity between doctor and patient, which technology can fix. The other is a regulation that governs either the doctor, the patient, or the both. And you have numerous incidences of physicians living in a region where they can practice, but they can practice outside the region where they live in. So as you start to look at the advent of blockchain, it's not just about trust. It's also about auditability. It's also about having a immutable proof of who did what and under what governing law did they act and who was impacted and how they were impacted. So telemedicine is a great example. Telemedicine is proliferating, as Kingsley said earlier just a minute ago, that it's going to be a very meaningful use case for blockchain healthcare overall, and it is already. But really where the opportunity lies is for blockchain to both manage and work within the framework, regulatory framework that applies to the doctor or the patient, regardless where they live, but also to prove that they acted in the best interest of each other, or they complied with the law, or what they did was not regulated by the framework of where they live. So bottom line is, I think blockchain becomes a defensive mechanism for the physician, because the physicians do need to make sure that they don't get sued either by patient or by regulators for delivering care. And blockchain gives them can give them the appropriate framework in which they can function. I may not be licensed, I may be living in Toronto, but if I'm allowed to practice medicine with a patient in a far off country where the regulatory framework permits that interaction, then the local regulatory framework is not really applicable because I'm practicing medicine to a patient that is permitted to receive care from me. So there is lots of opportunity here to both comply with the regulation as well as to expand the universe of care delivery and care receiving population without violating the regulations that might exist.
Yeah, I see a very good point here. Another question that I have here: are we ready at this current moment to embrace all those advantages that the blockchain technology is providing? I mean, it's clear that the regulatory framework, it's one of the issues. Some other might be the way the people are interacting with the blockchain. But we know that there are many other bottlenecks which stop us doing those steps. So I would like to go one step in this direction, please, because anyway, we have only a couple of minutes left in this.
Yeah, the question is, sorry, can I go in?
Yes, please.
Yeah, the question is not whether we are ready or not. The situation right now gives us no choice. There is a restriction of movement due to the pandemic, and we have different regulations in different countries. But as you know, human beings are not used to change. We don't want to change. The government don't want to change. The government in developing countries don't want transparency and accountability, because when they have that, they cannot fight for money. But blockchain was created to put democracy in your hands. You decide what you want as an individual. Blockchain gives you the platform to be able to manage your medical data. Blockchain gives you the opportunity to reach out to a lawyer or a doctor in Canada or America or in the developed countries. It allows a doctor in Nigeria or a doctor in Japan to collaborate without borders. So we've been talking about doctors without borders. Blockchain is going to help in pushing this forward. So blockchain is going to help the common man on the street with payment system. When you look at the recent trend in blockchain, people are investing more in payment system with the unbanked, the unbankables in developing countries. The population is very high, but a grandma who has an application that a grandchild can send money who is a refugee in Germany or a refugee somewhere else in the world can send money to her, and she can collect that money in less than 2 minutes or 3 minutes without going through the where's your ID card, where is this, where is that. They are bound to embrace it. We have to make it simple. We have to make it to the extent that you are a primary 5 student is people is able to understand it, which means the grammars, the uneducated will understand an application, a simple application that will be for their healthcare, that will be for their payment system, that will be for day-to-day living. So they will definitely embrace it. We don't have a choice here.
I think that it also depends. Sorry, go ahead.
Go ahead, sorry. Go ahead. I'll let you talk. Go ahead.
Oh, thank you, Atade. No, just a quick one to say that I believe that it also depends on the industry. For example, and related with the regulation again, in the finance industry, we see that regulators are really, in my opinion, fighting back the adoption of blockchain. So if you see, for example, in terms of what is infrastructure, we see, for example, Mashreq Bank in Dubai is using blockchain for their KYC system. You have a blockchain being used in trade finance systems. But so the regulators are quite comfortable with that because they see that as just another option, technological option for those banking services. But when it comes to money, they really resist, and we've seen that with Libra from Facebook and all the other attempts to use cryptocurrencies in the banking system. So I think that as users, as consumers, we are all ready to use the blockchain because all consumers in the world are very flexible, and blockchain, the intention is to be an underlying technology and for users to have better service levels in the end. So the thing is really to fight some of those challenges that are in the way. And with the notion, I think that blockchain obviously is not the solution for everything in life, but is really a system that can improve the level of efficiency and bring benefits like transparency and all those other benefits that we've been already discussing, right?
Thank you.
And so also, so basically to second what everybody has actually said, I do believe that governments want blockchain. Right before COVID-19 came in, there was this whole push for the SDG goals, right? And so one of those goals was to make sure that nobody gets left behind. And so blockchain is a tool that can be used to provide a solution to meet that goal. For example, Canada, to talk about like something concrete, recently allowed a Bitcoin fund to be launched and to be listed. And so that was something that a lot of people weren't expecting, but it has launched. So all of these concrete examples are very encouraging. However, before we actually get to complete adoption, like Kingsley mentioned, we need to ensure that there is education, because with innovation, there's always a push against change. But you cannot innovate if you do not educate the people who have to accept that innovation to use your innovation. So yes, there is hope, but there is also a lot of work to be done.
Thank you, everyone. Thank you for the things that you've shared with all of us today. So, as a small proof of what blockchain can do, we've decided to organize all the event concept between all of us, all the panelists. This is like a surprise for each of us. So during the next few days or week or two like this, we'll go through and we'll really tokenize the company which holds the rights for for this, and we'll split it equally between each of us, because it's important for each of us to interact, maybe for the first time, maybe for the second time, with a real ownership proof via the blockchain. So this is what we'll do next. So, and after maybe we'll have other idea to do for different target projects, each of us, individual projects. But yeah, this will be an exercise that we'll do in the, let's call it a security token creation. It's not offering, it does not have a value in the back. It's only an ownership proof, and each of us should interact with it to understand better how it works. So having said that, again, thank you all for participating. Thank you for the great things that you've shared with us today, and hopefully we'll see you soon, and also on the next virtual blockchain summit. Thank you very much. Thank you.
Thank you for putting together a good panel. Thanks very much.
Thank you, Sergio. Thank you, Manuel, for putting this together and for inviting me.
It was a great pleasure meeting everyone here. Thank you very much. Have a good night and stay safe.
Thank you.
Thank you.
Thank you. Bye.